The following paid program is sponsored by Lexington Plastic Surgeons.
The human skin, it protects us, it defines us, and it depends on us to take care of it like it takes care of us. But life happens, and so does scarring, and for some, those scars can turn into embarrassing keloids.
Hi, I'm Kathleen Trigg. As a TV personality and actress who spent my entire career on camera, I know firsthand the importance of keeping your skin looking flawless. After all, it's the first thing people notice about you, and that camera can pick up on even the tiniest scar. But the truth of the matter is, whether you're a model or a mother, a father or a son, we all want to keep our skin looking healthy and picture perfect. And that's why I want to tell you about a revolutionary new product that could dramatically reduce the appearance of scars and keloids on your skin. Results that could change the way you not only look, but feel on the inside. That product is Keloid Care. And today we are standing inside of the state-of-the-art House of Beauty, where Keloid Care was developed by celebrity plastic surgeon Dr. Michael Jones. In just a few minutes, we're going to meet Dr. Jones, who spent the past 10 years perfecting Keloid Care to use on his own patients. But the true testimony will come from people and what they have to say about this revolutionary new product.
I first heard about Keloid Care when my daughter Marley hit her chin on the side of my table, and I took her to Dr. Jones to get stitches, and he stitched her up beautifully, but I was still afraid that she was going to have a scar on her face for the rest of her life. So he recommended Keloid Care, and I applied it, and it was barely visible, her scar, after a few weeks.
How I got my scar is that I supposed to be washing dishes, and my cousin was to help me, and I told him to pass me the cup that was on the table. Instead of him passing the cup to me, he winds up tossing the cup, so when I looked for him to pass it, it's actually in the air, and I looked at it, hit me in my head, so everything, blood and everything just started coming. It was a mess.
I would feel a sense of relief if someone told me that my keloid could be taken away by a product. I would feel like I have a second chance to feel confident again.
Keloid Care is a new and innovative topical cream specially formulated to reduce the appearance of scar tissue and discoloration. Developed by leading celebrity cosmetic surgeon and founder of Lexington Plastic Surgery, Dr. Michael Jones, Keloid Care is one of the first and only scar creams specifically formulated to address the needs of people suffering from the most stubborn and unsightly scars and keloids. As a board-certified cosmetic and reconstructive surgeon who has been featured in numerous magazines and in television interviews on most major TV and cable networks, Dr. Jones has treated hundreds of patients, from celebrities to people just like you, for everything from body enhancements to annoying scars.
To be a cosmetic surgeon is about understanding the needs and desires of your patients. It goes beyond the medical needs, and when they come to me to have something enhanced or corrected, I have to think about every aspect. For instance, how will their skin heal after a surgical procedure? Will they be left with a scar? It is this concern for my patients that led me to spend the last 10 years developing Keloid Care.
Dr. Jones is not only a board-certified cosmetic surgeon, he also happens to be my husband. And he's been keeping my skin and countless other people's skin, including a lot of celebrities and all of my TV friends' skin looking flawless. And of course he can do the same for everyone else out there, and that's why we're here today. But I know what you've been through to develop this product, but if you could just explain what people feel like by the time they come to you because of a scar or a keloid.
By the time they come to me, their self-esteem is quite low. They've usually exhausted all of the traditional therapies. They may have used all of the over-the-counter products that exist. Sometimes they've already gone to see a surgeon for scar revision or scar excision. And very rarely, they may have even gone for radiation therapy. So by the time they get to me, their self-esteem is quite low. And they're really desperate, looking for some kind of solution.
Call 877-7-KELOID now or visit keloidcare.com to order your supply of Keloid Care for just $24.99, plus shipping and handling. and take a stand against those unsightly scars and keloids.
You know, as a mom, I always want to protect my kids, right? Yeah. And, you know, but we can't protect them from every single cut and bruise, and some scars are worse than others.
I know, like when my daughter Marley hit her chin on the table, and it was awful. But I went to Dr. Jones for stitches, and I was really terrified that she was going to have a scar for the rest of her life. And he recommended keloid care, and we put it on morning and night, and you can barely see the scar now.
Because keloid care worked so well on Marley, I used it on Mayan when he hurt himself on the playground. And you can barely even see the scar.
No scars, you get a pretty face again.
I don't see it.
You don't see it, because it's all gone, right?
Keloid Care combines the powerful antioxidant beta-ionone with other natural ingredients such as aloe, cocoa butter, shea butter, hydrocortisone, vitamin E, and silicone to create a unique formula that travels deep beneath the skin to the core of where scars and keloids form. In addition to reducing the appearance of scars and keloids, Keloid Care helps soften and moisturize your skin, leaving it looking and feeling its very best.
Many of the over-the-counter scar products have ingredients that have been clinically proven to aid in wound healing, such as hydrocortisone, silicone, and vitamin E. Well, we have combined these ingredients, plus added some of the ingredients that our grandparents always told us about would help with scarring, botanicals that are actually very potent skin moisturizers like aloe, cocoa butter, and shea butter. We then combined all of these with the very potent antioxidant beta-ionone. As a wound heals, the inflammatory response produces significant free oxygen radicals, which actually did not provide for the best environment for wound healing. Beta-ionone reduces these free oxygen radicals, providing for the optimum environment for wound healing. So whether you have a small scar, a blemish, a hypertrophic scar or keloid, a new scar or mature scar, Keloid Care may help you reduce the appearance of an unwanted scar. In fact, I trust Keloid Care so much I even use it on my own family.
I was pregnant with twins, beautiful 2 little babies. They're 10 months old now. I didn't have any scars prior to my pregnancy. I was fine, my skin was clear, it was healthy, it was glowing, everything was great. And I ended up having an emergency C-section. And that's when, you know, I thought everything was going to turn out great and fine. I made sure I let them know I wanted a bikini cut so that I can possibly wear bikinis and bathing suits and get back to my normal life as well. And still feel confident about my body. And then after the surgery, during the healing process, I started to see that my skin keloid. They are prized possessions of mine. But the scar, to remember it, is not a good thing. I would like to possibly get rid of this scar. I want to be scar-free, keloid-free, and that's what I'm looking forward to.
So we just heard from Ebony. Your story is you know, it's heartbreaking to hear what you're going through. So listening to her, do you think that she would be a good candidate for keloid care?
Well, Kathleen, the best way to find that out is to actually examine her. Hi, Ebony. I'm Dr. Michael Jones. It's a pleasure to meet you. Thank you for coming and sharing with us.
Thank you.
Now, I've heard a little bit of your story.
And I just want you to tell me in your own words what it is that concerns you the most about the scar.
I just want to feel comfortable in my skin, and I'd like to possibly wear a bikini again.
Absolutely. Now, how long has this been going on for?
About 10 months.
About 10 months? Mm-hmm. And are you having any pain associated with it?
I do get a little pain, maybe every other month, a small sharp pain, and it itches.
Itching. Well, itching is actually a telltale sign that the scar is actually growing. So I think that we should take a look, if you don't mind. Many scars that are starting to become keloids will first start off with a slight elevation. They will then start to itch or maybe even cause pain, and sometimes they'll even bleed a little as they are actually continuing to grow. You have to remember that these are almost like benign tumorous growths. And so they will continue to grow. The cells there are producing collagen on top of collagen and don't really understand that the wound is actually healed. So they will continue to expand and elevate and go into other areas around the scar. So the entire length of the scar has become slightly elevated. It is darker than the surrounding tissue, and it is starting to spread and widen. Have you had any treatment to it at all?
None.
None whatsoever. Okay, well this is actually a very ideal scar for keloid care. And the reason being is that there are varying degrees of keloids. Some are much higher, and some are much wider, some are much longer. This one is not so high, and it's not so wide, so it's very amenable to keloid care. It's early in the healing phase, the scar is still maturing, so this is a scar that could be adequately treated with keloid care.
Does that mean it's not going to get bigger necessarily?
Well, if left untreated, unaddressed, most keloids will continue to grow, and that itching feeling that you're having on occasion is a sign that it is growing. It's a sign that more collagen is building up on top of itself, and that's going to cause this to get a little wider and maybe even a little taller.
Oh, wow. Well, should I scratch it?
What you don't want to do is cause anything that's going to give it inflammation. You want to treat it with kit gloves, if you will. And the keloid care has a very nice viscosity to it. And what you'll do is just take a little dab of the keloid care and deeply massage into the incision. And you want to do that several times a day, because it's actually the pressure that you will apply to the scar that will help to tell those cells to stop producing collagen and to level out into flat.
Okay.
This is a mild keloid. It is not one of the large ones, because many of the larger keloids that we see in our practice actually require surgical removal.
Okay.
And that surgical removal would literally be taking the scar or the lesion out of the tissue and then bringing good tissue together with good tissue and then sewing that together.
Now, once someone keloids like that, would she be prone then to growing another keloid?
Well, it's hit or miss. The reality is that we really don't understand why it is that these keloids form. We have patients that go their entire lives without ever having a keloid, but then suddenly in their late 60s from a small little scratch can develop a huge keloid. Most often your tendency to keloid decreases as you get older.
Okay.
But for whatever reason, the inflammation as this scar healed created a slight elevation to the skin.
Okay.
So her orders. She's going to go home. She's going to take some keloid care with her, and she's going to apply it.
Thank you.
How many times a day?
3 to 5 times a day
Okay.
would be ideal. And we know that maybe you can't do it 3 to 5 times a day, but as much as you possibly can, you want to apply it with a very vigorous massage to the incision.
Oh, definitely I will.
So what do you think, Ebony?
I'm going to give it a try.
Good. Well, we hope to see you back. You have to let us know your results.
Thank you.
Okay.
I
All
will.
right. Well, thank you, Ebony, so much for joining us.
Thanks for having
And
me.
we actually have another patient that we're going to hear from.
Wonderful. Ebony, it was a pleasure meeting you. Thank you so much.
Thank you. Thank you.
Now, how would you tell the difference between a scar and a keloid? I know people ask me that all the time because I've seen patients come in to see you and they have this scar they're complaining about, and then you see them and you always say, well, no, actually, it's not a keloid, it's just a scar.
Many patients will come in and they'll have an incision or a scar that's slightly hyperpigmented or dark in color and maybe just slightly elevated above the normal skin level, and they'll believe that that's a keloid. Well, that really isn't. That may just be a hypertrophic scar. A keloid really is an exuberant overgrowth of skin that forms at the incision site or the site of injury, and it just overgrows the incision line. It almost starts to invade the surrounding tissues. So many patients are very distraught when they have these because they're quite disfiguring in nature.
Now, I know a real common question is whether keloids only affect African Americans or people with dark skin.
Well, that's a wonderful question, and I think there's a misconception about that. The reality is, yes, as African Americans or people of color, we have a higher tendency to develop a hypertrophic scar or a keloid. But the reality is that anyone of any color, any race, any ethnicity could develop this. And in fact, many of the clinical studies that have been done on the biochemistry of keloids and hypertrophic scars actually were performed in a very pale set of Jews. So we developed a very universal product, a product that can be used in any skin type, any skin complexion, any ethnicity.
Call 877-7-KELOID now or visit keloidcare.com to order your supply of Keloid Care for just $24.99 plus shipping and handling, and take a stand against those unsightly scars and keloids.
I got my scar. I was supposed to be cleaning up one day, washing dishes, me and my cousin, and I told him to pass me the cup off the table. Instead of him passing me the cup, he tossed the cup, so it went up in the air. So when I turned around, thinking he's passing it, it hit me directly in my forehead, and so blood just started coming. I was like, oh. So it was crazy. I have to say, I was in the gym one day, and we was working out, and I was telling him about back fat and everything else, and he was, my friend was telling me something about, oh, you got to do more obliques and everything else, or you could just have liposuction. He said, while you at it, why don't you just have that scar removed too? So it was like, wow, a real hit blow. Like, do people really notice my scar on my head? So so ever since then, I started becoming very self-conscious about my head, as it is big already. So, but I've become very self-conscious about my head.
Okay, so we just heard Courtland's story. Your cousin did that to you?
Yes, I was supposed to be washing dishes, and I asked him to pass me a cup. And instead of him passing the cup, he tossed the cup and it hit me dead in my head.
And what'd you do back? Does he have a scar we need to treat too?
I was too busy worried about my head.
Dr. Jones, what do you think? Can we do anything for that?
This scar that you have, you've had for over 20 years, and it's a very mature scar, we can tell. And it's a scar that actually, even though it's 20 years old, is still quite amenable to the use of keloid care. Why is that? Well, the nice thing about this scar is that it's not elevated, and it's not thickened. It's not a keloid, it's not a hypertrophic scar. It's just a flattened, hyperpigmented scar that's unfortunately in the middle of the forehead. So the nice thing about keloid care is that one of the things that happens very early on while you're using it is usually within the first 3 to 4 weeks. If you're applying it directly to the area that's dark, you will start to see that area start to lighten. And it's important to take a Q-tip such as this and literally paint it on the area that's dark, because if you use a wide area of the product, that area will also lighten as well, and thus the contrast won't be appreciated.
How does it sound?
Sounds great. Anything to minimize the, discoloration.
Are you real self-conscious about it?
Yeah, because sometimes I walk around, I think that's the first thing people hear, so it's like I'm rubbing a genie on my head, because they're like, what are you doing? I'm like, nothing.
And see, that's the thing about scars, because sometimes other people, because to me it doesn't look so bad, but you notice it, and it's like the only thing that you see when you look in the mirror. Right. So here's the keloid care.
Thank you.
So I want you to go home and try it, and let us know what you think.
Do. Smells good.
Very good.
Good. Thank you so much, Courtland.
Thank you. Thank you.
Thank you.
How is keloid care different from other over-the-counter products that people might try for scars? For instance, I remember I had the burn on my hand and I treated it with keloid care, and I think we have the before and after pictures. But there's other products that I've used in the past for scars that left a film and they didn't really smell very good. How is keloid care different from those?
Well, that's very true, and I found with a lot of my patients, when I told them to use other over-the-counter products, they really weren't compliant. Meaning they just really didn't use the product because it just didn't fit into their lifestyle. So what we had to do is we had to create a product that eliminated some of those problems. There's no medicinal smell to this product. In fact, it has a very nice, non-assuming fragrance to it. It will not form one of those plastic, silicone-looking sheets over your incision so you can go to work and wear this product. And there's no necessity to wear a bandage or a Band-Aid over top of the product. So it's really ideal for someone to be able to use the way it's supposed to be used.
Whether you have a scar or keloid, the important thing is to start treating it as soon as possible with keloid care. Applying it couldn't be easier. You simply clean and dry the affected area thoroughly. Then massage a dot-sized amount to the scar or keloid you want to treat 3 to 4 times a day or as needed. And you should start noticing a change in your skin within 2 to 4 weeks.
Call 877-7-KELOID now or visit keloidcare.com to order your supply of Keloid Care for just $24.99 plus shipping and handling, and take a stand against those unsightly scars and keloids. Results will vary from person to person based on individual skin type. Keloid Care should not be used on open wounds or mucous membranes. Some keloids may not respond to Pico agents, and surgical treatment by an expert like Dr. Michael Jones may be required. Call 877-7-KELOID now or visit keloidcare.com to order your supply of Keloid Care for just $24.99 plus shipping and handling, and take a stand against those unsightly scars and keloids.
Convinced yet? As you've been hearing, Keloid Care just may reduce that scar or keloid you never thought would go away. It just may change the way you not only look, but the way you feel for life.
Be one of the first 100 callers and get a second jar of Keloid Care absolutely free. That's right, 2 jars of Keloid Care for the price of 1. Call now while supplies last at 877-7-KELOID. That's 877-7-KELOID or 877-753-5643, or visit us online at keloidcare.com. But wait, we're so convinced you'll get maximum results from Keloid Care that we are willing to ship the first 50 orders for free. You heard it. Be one of the first 50 callers and get 2 jars of Keloid Care for just $24.99. Don't waste any time. Visit our website and place your order today at keloidcare.com. That's keloidcare.com, or call us at 877-7-KELOID.
Because beautiful skin does matter. Thank you for joining us.